Tanya, it's Dina. This is a hard video for me to make, but it's one that I felt like was important to make because you're not alone the way you feel about your skin. I have actually taken some pictures. I took these myself, and I'm going to post them at the end of this video. So anybody who happens to be watching this video right now, I'm warning you, they are graphic. I'm not showing anything that is pornographic, but they are graphic pictures. You get to see me in most of my glory. There's pictures of my legs, mostly my inner thighs, which are really bad. To me, they're really bad. Things that bother me. My saggy breast, but, you know, I think that I discreetly covered the parts that I shouldn't show on YouTube. And my arms, which aren't too bad, and my stomach, which to me is really bad. I feel like I look like a deflated balloon. A balloon that's been overinflated and then left to sit for a couple days in a hot car. If that gives you any idea. I have gone from 297 pounds to 130. This morning I was 133 pounds. And I bounce back and forth right now between 132 and 139 pounds, depending on the day of the week, if I've worked, what I've eaten, and that kind of thing. This morning, like I said, I was 133, so that's a lot of weight to lose. And I've done that in 18 months, and actually a little bit less than 18 months. So rapid weight loss, and I'm 41 years old, and my skin was not incredibly toned to begin with. A lot of things that play into how much saggy skin you're going to have left are genetic. There's nothing you can do about it. Once you have stretched that skin, I've actually had a plastic surgeon tell me, and I've been to seminars, and I'm a nurse, and all of this, so these are things that I actually know. But once you've stretched that, you've lost that elasticity, you've lost that fiber. Once there are stretch marks there, it's not going back. So the only thing that I can hope to do really is, you know, I can do some muscle toning, but I can't do anything about the skin. And I can have plastic surgery, which is going to leave scars, but, you know, at least it's not going to leave this flapping skin. And I do mean flapping skin because, depending on how fast I'm running, sometimes I can hear it. It's nothing that I can't cover up in clothing. In fact, I had a patient one day last week who she had gastric bypass, and that's why she was in the hospital. And I told her, you know, after I had assessed her and known her for a few hours, you know, I went back in the room, and I said, she was complaining about some of the pain, and I said, it does go away. Trust me, I know exactly what you're going through, and it does get better. My first night was my worst, and she said, you've got to be kidding me. Why would you have gastric bypass surgery? And I said, oh, let me tell you. You know, so I had to go through my story, and a lot of my patients don't believe me because in my uniform, which is a size medium, and it's a large medium, you don't see my skin. You honestly do not see my skin. And in most of the clothing that I wear, you know, just because I can fit into a size 8 doesn't mean that I should fit into a size 8. So I wear clothes that don't show off that skin. And so, you know, people don't realize it. They really don't. And you can dress appropriately for what you've got until you do something about it. So exercise is great, but it's not going to take it all away, unfortunately. And I still, even with the loose skin, I knew that was going to be something that I was going to have, so that was not a deterrent for me at all for having surgery. And even with it, if I'm never able to get plastic surgery, I'd do this all over again, you betcha. So I'm going to put these pictures in, and you know, it takes a lot of I don't know what to be able to do this because I really am a private person, but I've had people ask me, and this patient that I was talking about actually, she asked me to show her my skin, and I thought, well, okay, I don't know how my employer's going to feel about this, but it is educational. So I showed her my stomach, which I felt pretty comfortable showing her, but I pulled the curtain and made sure the door was shut and all of that stuff, so she got a kick out of it. And she said, you know, wow, I never would have thought that you even had that. So anyway, it's there. It is what it is. And until I have insurance that hopefully the first of the year will pay for plastic surgery, I'm stuck with it. So I'm going to continue hiding it in my clothing until I can get rid of it. So if you don't want to see these pictures, turn this video off right now, because they are coming up, and hopefully they're self-explanatory, but the skin is so saggy that I'll try to figure out a way to label the pictures and tell you what they are, just in case you really can't identify what they are. So if you have any questions or comments, then you can hit me up on YouTube.